Good evening. Welcome to another episode of Kidney Disease Education Moment. I am your host, Steve Belcher. Hey, Donna, how you doing? Thanks for joining. Tonight, this is, I believe, a great topic to talk about, especially if you're on kidney dialysis, and that is appointing a healthcare agent. I think that's very important if you're on dialysis. So, appointing a healthcare agent is a legal process of assigning another person to make healthcare decisions on your behalf if you are unable to communicate your wishes. Your agent can talk with doctors, make decisions about tests, procedures, and other treatment. This person is also referred to as a healthcare proxy or durable power of attorney for healthcare. The names and form requirements kind of vary in different states, but what I've seen in my career with people who start dialysis, this is one thing that they don't have set in place, and there are complications to dialysis. There, it, I don't want to say they're rare. They can happen. Hey, Lawrence, how you doing? They can happen, but when they do happen, the person want to be prepared to have someone to make decisions for them, especially if they can't communicate, if they're intubated, meaning they have a tube in their throat, and the doctors can't even get any information. So it's great to have someone set in place for this. So who might be a good choice to make this decision for that person? A spouse or partner, a son or a daughter, mother or father, sister or brother, or friend. Someone may not come to mind immediately when you're thinking about making this type of decision. Think about the people in your life. Other options include a distant relative, neighbor, or someone at your place of worship. And that and that's true, especially for people who don't have children, who are alone, maybe a widower or a widow. Because again, kidney disease is a broad spectrum of the people that it affects. So you got people who are living alone that deals with the disease. So if something happened with them, they need to have someone set in place to make these decisions as well. These are some of the things that people should think about. One, will they be able to make decisions for you, even if their own wishes are different from yours? So if you have a relative that you assign to be a healthcare agent, will they be able to make these decisions for you, even if their own wishes are different from yours? Maybe you don't want to be intubated on in ICU. You want to, if something happened, you rather just go ahead and transition. Maybe your son, daughter, or close family member may not want that for you when they experience that situation right there at hand. So this is something really to think about. Some people may not want to be on life-saving support if something happens to them. They say, if that's it, let me go. But then you have family members who may think the opposite. I've seen this with my very own eyes where you had someone keep a patient on life support so they can continue to get their disability check. Number two, some of the things that you want to think about with their feelings, the person that you assign to be your healthcare agent, where their feelings for you get in the way of making decisions on your behalf. That's something to think about as well. Number three, will they stand up for you? Whoever you assign to be your healthcare agent, will they have your best interest when the doctors come in and need to make some real critical decisions about your health care, will these people stand up for you who you may set in place? These are some of the things that you got to think about. If you're on dialysis and something happens and it renders you unconscious and you go to the hospital, who's going to make those decisions of what medicines they give you if you need a procedure done? Who's going to answer those questions for you? Number four, will they be comfortable asking questions of busy doctors and other providers? Someone comes in and do a procedure, draw labs, just starts messing with you, and you have someone in your room who you think is going to be your healthcare agent. Will they ask questions? Why are you drawing blood? Why is this procedure being done? I mean, it's a lot to think about, but this is something that needs to be talked about, and it's rarely talked about. Number five, where they ask for clarification if the answer or situation isn't understood. That's important. Number six, will they be able to make decisions in changing situations? Number seven, will the doctor be able to reach them when needed? What if the person that you assign to be your healthcare agent, the doctor needs to call them or someone needs to call them and they're not available? Maybe they're at work, they can't get the call. I mean, this is something to think about. And number six is important. Will they be able to make decisions in changing situations? Because if a situation is not favorable for you, will they understand the medical jargon or what's being explained to them so that situation could be changed so they can make the best decisions for you? So choosing someone who isn't a family member or friend, sometimes it is difficult for a partner or family member to be your agent. It's really difficult for your own family member to be that agent because emotions may come into play. And usually that's what happens. Emotions come in to play when you're making critical decisions. For example, they find it too difficult to agree to ending treatment because of their relationships with you. Even if you have made your wishes very clear, you could tell somebody, look, I want to be cremated. I don't want to be on life support. And the other person will argue you down saying, no, why you want to do that? That's your decision. If that's what you want to do, that's your decision. That's someone else's emotions getting in the way of your choice to make this decision for your life. Um, Even if you made your wishes very clear, in this case, it may be wiser to pick someone else. If you do choose someone else, it is important to be sure your partner or family member know who he or she is. They should know who this person is. You can say, this is an example of what you can say. I chose blank, my friend, because she or he will be able to speak for me without becoming too emotional. And this will take the pressure off of you. Very important. That is very important, and that can get your point across without feeling that you're being disrespectful. I mean, you're being tactful, but you're just being um, mindful of the situation, especially when it comes to making decisions on your life. Again, this is if you're in this situation, this is what you can tell your family member if you choose to have someone else outside of your family to be your healthcare agent. You can say, I choose my friend, whoever that friend is, because she or he will be able to speak for me without becoming too emotional and this will take the pressure off of you. Okay, so let's talk about some myths about appointing a healthcare agent. A lawyer must prepare an appointment of healthcare agent and or they are very expensive. Excuse me, that is false. These are legal documents, absolutely, but they do not need to be prepared by a lawyer. However, state law varies, and it is important to find the correct forms and signature requirements that apply in your area, your state, or where you're at regarding a healthcare agent. If I appoint and healthcare agent, I will lose my decision making power. So some people believe that if they appoint someone else to make decisions, if that renders them to communicate what their wishes are, that they will lose their decision making power, and that is false. Your agent will start making decisions for you when your doctor, okay, your agent will start making decisions for you when your doctor determines that you are not able to make healthcare decisions for you. So this is a process, okay? The doctor has to determine if the person that's rendered unconscious or not able to make decisions, the doctor has to make that decision, okay? Now, you can talk to your healthcare team about this, your social worker, um, anyone that you feel that can be a healthcare agent for you or have some type of medical knowledge and that's very mindful. Talk to them. If you don't have a healthcare agent, think about it. It's really something to think about, especially for long-term use, especially if you have a disease or a condition. Say, for instance, if you have seizures, if you're on medication for seizures or any condition that may render you unconscious at any time, at any moment, just out of just coming out of the blue. So it's really important to think about this and see if it applies to you. Also, it's good to have a advanced directive set in place. So if you do or if you are rendered unconscious during the treatment, do you want the staff to administer CPR, which entails cardiac compression or breathing, or do you just want the breathing, or you don't want nothing at all? That's very important because some people, especially patients that are up in age, that are, let's just say, 80, 90 years old, would you want, if you had a family member on dialysis that was 90 or 95, and there are warriors that are on dialysis that are 90 and 95, would you really want to do chest compressions, and especially if this person was frail? These are the things that you got to think about because you may be doing more harm than good. And that's where you have to think about, uh, do the end justifies the means? So again, we talked about appointing a healthcare agent, being prepared. I believe as a healthcare professional, this is very important for kidney warriors, their family members, or friends that you know that have kidney disease that may need to think about just appointing a healthcare agent just in case. Let me see, I have some comments that I'll look at before I close the education session. Hey, Kim Keith, thanks for tuning in. We do this every Friday. It's called the Kidney Disease Education Moment right here on Urban Health Outreach Media page. It starts somewhere between 8:30, and we talk each Friday. There's a different education topic pertaining to kidney disease and dialysis. Let me see some of these comments. Hey, Lawrence, thanks for tuning in from the UK. This is very important message you passing, Steve. It's about organ donation, opt out. You hit it deep and clear. I'm not too familiar, Lawrence, about the opt out, but maybe one day, I know you in the UK, maybe we can kind of sync and do a show about that, and you could talk about that. I have a gentleman named Gene Shamando. He's a heart transplant recipient, and he talks about opt out. And I never got into that, so let's talk about that, or at least send me a messenger just explaining what exactly opt out is. Thanks for sharing that. Hey, hey, Donna, how you doing? Thanks for tuning in. I appreciate your support, even after the show with Nick. Again, thank you for all you do and your support and involvement in the kidney disease community. Hey, Lawrence. Okay. Okay, guys. So, for those of you who may have just joined us, I went over appointing a healthcare agent. And just one more time, appointing a healthcare agent is the legal process of assigning another person to make healthcare decisions on your behalf if you are unable to communicate your wishes. Your agent can talk with doctors, make decisions about tests, procedures, and other treatment. This person is also referred to as a healthcare proxy or durable power of attorney for healthcare. The names and form requirements vary from state to state. Um, just going to say this one more time, who may be a good choice: a spouse or partner, son, daughter, mother, father, sister, brother, or friend. Um, so thanks for tuning in. Share this video. It's very important. Have them watch it. If you know someone on kidney dialysis, or if you know someone who has a family member on kidney dialysis, please point them to this video. Thanks for tuning in to the Kidney Disease Education Moment. I'm Steve Belcher. Good night.